This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I am delighted to welcome as a guest Jackie Ralph, who is a Supervisor Youth Awareness and Education with the Canadian Mental Health and Addiction Services and Grey Bruce location. You'll have to correct me if I get this all wrong, Jackie. Today we're going to talk about a really important training session that is available called ASIST, and that is Assisted Suicide Intervention Skills Training. I hope I have that right. Jackie,
thank you. You were so close. Yes, all good. Yeah.
I'm holding my paper up in front just in case. I want to thank you for being on the program today because this is such an important topic. And you know, I will have questions for sure, but mostly I'm really here to listen and learn because this is something that you do. You do the training, correct?
That's right. So I always start by repeating those 12 words. So we are the Canadian Mental Health Association, Grey Bruce Mental Health and Addiction Services. We have 12 words in our name. But I always tell whenever we're out and about, I say the reason it's 12 words in our name is because we need a big umbrella because we have 167 staff in our agency providing 45 different programs. And so you need a name that big to have a big enough umbrella to fit them all under. But under that umbrella is our prevention training programs, and one of them is ASIST. And ASIST is Applied Suicide Intervention Skills Training. It is a program of an agency called Living Works out of the States, and it's one of many suicide prevention programs they offer. ASIST in itself is 2 full days, just like CPR first aid would be a full 2 days. And then they have different levels. Safe Talk is kind of like the pre-training for ASIST. Safe Talk is a 3-hour conversation where we just get together and have a conversation about what suicide looks like and sounds like and feels like in our gut, and then how to connect them to help. And then ASIST becomes, hey, if I'm willing to put myself out there as the help, then we want you to take the Applied Suicide Intervention Skills Training so that you have the skills needed to do that. And then they even, Carol, have what's called, Living Faith, I think it's called. And that is a suicide prevention training specifically for our faith community. So our ministers, all that, because again, in the church community, you may be having conversations with parishioners and folks that come on a regular basis. And we know faith is such a big, an important thing for so many people. So we want to make sure those folks have the skills that they need.
Yeah.
So,
and I'm glad to hear. I had said it was ASIST, but it's the Applied Suicide.
You got it. Yeah.
Thank you for that. So, why is this important now? Has there been a change? Because I'm not sure I heard about this training.
Right.
And what are the statistics telling us?
Yeah. So one of the first things we always talk about in ASIST is we talk about the numbers. We got to paint the picture for exactly that reason. Why are you here? Why are we so happy that you signed up for this training? And it's the numbers. So I remember kind of when I first took the training, the statistic was around that we lose 3,300 Canadians a year to suicide, which is give or take 10 Canadians a day. But that number has gone up. And since that time, in that 10 years, we're in the 4,000 Canadians a year, and we're almost at 15 Canadians a day. So that's 15 Canadians too many every day is how we always look at it. And the thing with ASIST is we can't ever fix or remove thoughts of suicide. Suicide is part of being human. There's each one of us is going to have a day in our life where we look back at that day and go, that was a really hard day. And I don't necessarily want to have to do that again. That's kind of what suicide is. It's where life is hard and the thought of having to reapply and do that again is overwhelming. And so what ASIST does is it just gets in the way of that thought. And it just becomes, let's provide a different option, right? And we don't have to agree to live forever, right? Because right now, even just living 5 minutes is overwhelming. So how can we support that? And that's, so ASIST is 2 full days. It's a lot of scenario work. So we do a lot of what ifs, and we look at a model. Everything has a model, right? We look at when we do CPR first aid, right? You do the ABCs, right? You start at airway, you move to breathing, and then you go to circulation. ASIST is the same. There's a model we follow. We call it a pathway, and it's a pathway to assist life, to make it so that, in that moment when thinking about living is hard, well, what can we do in that moment to we don't have to think about suicide. We don't have to think about life right now. We just have to, how do we keep you safe just for the next little while?
Yeah. So those numbers are actually staggering. So I'd like to know, from your perspective, where we stand in Grey Bruce in relation statistics. The age groupings, if there's particular more high risk. Mostly in the interviews I do, what's been the impact of COVID? So do you mind taking a moment to explain?
So the most recent statistics and the ones we use in the training were actually from the impact report that came out a few years ago. Sarah Cowley and her team went to all the agencies, public health, police services, CMHA, and they gathered all the statistics and put it into a report. And when that report came out, wow, did it really knock some people, but it really shook a lot of the foundations of some folks, because in that report, it showed us that suicide here in Grey Bruce is the #1 cause of death of 25 to 44-year-old males. And that is higher than the provincial statistic. So that is worrisome, because we talk a lot about different demographics and which are the most at risk. So 100% our most at risk group is males. 75% of those that lose their life to suicide are males. And we also talk about how for our kind of 15 to 29-year-olds, our teenagers, suicide is the #2 cause of death. But that one, I hope we look at a little bit. It's not all doom and gloom, because, to be honest, teenagers are meant to get old and wrinkly and collect pensions. Teenagers don't die of a lot of things. And so that's why suicide, we hear it, oh, it's the #2, it's the #2, it's #2. And that's because there's not a lot of things on their list, right? Yes. And it's #2 to accidental. Accidental is #1 for that age range, and suicide is 2. In the States, it's a different list, because that age range, homicides is #2 and suicide is 3. So that's a statistic we try and hope doesn't come into play here. And then our other most at-risk group is seniors. But the thing with seniors is, again, when we look at suicide as living is hard right now, that's what suicide really breaks down to. With our seniors, it isn't so much an active suicide. It is more just stopping living. So we would notice with our seniors not accepting treatment, or stopping medication, or stopping eating. And so those are our 2 most at-risk groups here in Grey Bruce. And then demographically, the other most at-risk group for suicide is that males 44 to 60. But again, we don't hear about suicide as that high of a cause of death to that age range, because that's then when more things come into play on top, right? Heart disease and stroke, and so suicide falls down that list. But overall, males 44 to 60 and seniors are the most at-risk group.
So this is really critical. We talk about this because it is an issue for sure in our communities. So the training. So first of all, who can take the training?
That's a great question. I totally interrupted there. Anybody?
No, I like it. I like it. Interrupt all you want. It's your show, really.
It's intended to be for anybody over the age of 18, and it's meant to be for anyone, because what we do know about suicide is you are more likely to tell someone you love or someone you're close to or a friend or a family member before you then maybe get connected to services. So we think, like, we look and we go, oh, this is for counselors and ER nurses, and no, this is for that frontline person, and that frontline person is going to be a friend, a family member, your pastor, your spouse, and that's the people we want to get into the training, because they're the first ones that are going to notice something, hear something, be told something, and so that's who we want to have the training, is anybody.
So we'll talk specifically about the cost and how they sign up, because I'd really like to get that right up front. Have more questions about the training. So I don't have a lot of money.
Right. So it is, the cost of it is $200 a person. And that's kind of typical across the province. So it doesn't matter if you take it here or take it in Barrie or take it in Toronto, it's usually about $200 a person. Sometimes we see the costs subsidized. So we just had a full group in Wingham, myself and the co-trainer, because there's always two trainers, went down there, and Mental Health Matters Wingham is just a grassroots group of individuals who are who have said, hey, this is our community and we want it to be as safe as possible. And one of the ways of making it as safe as possible is having enough folks in our community that have this training. And so they paid for the whole thing. So people could take it for free, which was awesome. And then additionally, here in Grey Bruce, I like music and I like to dance. And one of my favorite bands is the Pickup Game Band. And they held a fundraiser maybe a little over a year ago now, in memory of a band member that they lost to suicide. So they had an evening where they brought all their friends and family, and we danced and we listened to music. And at the end of the night, there was $10,000 raised. So when you go onto our website and you click the button to register for ASIST, it gives you three options. One, my employer is paying for this, so bill them when we're done. Two, I'm paying for this, and you pay right off the hop. Or three, I would like to access the Ryan Remembered subsidy. And you click that, and it's like, cool, and it comes out of that little kitty, which is amazing.
So ASIST, and I want to clarify, it's ASIST, which is different than how we normally spell ASIST.
Yes.
But the intent is the same, but it's related. So you encourage any community member. Doesn't matter if you have medical training, doesn't matter, just, And other groups could also consider funding for training to the Canadian Mental Health Association, Grey Bruce. Do they do as a donation, right?
You got it.
Okay.
Yep.
Okay. So, and you run the courses locally normally do, Jackie? How often would you do that?
Yep. So we typically run it once a month. And so we pick a Thursday, Friday, and we hold it at the Knights of Columbus Hall because the Knights of Columbus are awesome. And they said, hey, this is important and we would love to give you a deal on this space so that this training happens. It's catered. So when you come to the training, we get to have a lunch break and we get to enjoy a meal together and just like debrief a little of, because sometimes it's a lot of information and it can be heavy information. So we sit and break bread together twice over the training. So that's lovely. Fresh Roots, Trevor and his team does so great. And then, so we didn't have the training in February because I found it was a short month and we just didn't have time, but we have it March, April, May, once a month, and you just go on to our website and we have a little calendar and you just look it up and go, hey, when's the next one? And I'd like to sign up for that. The March one is already full, so you won't find it on there because, Carol Merton, it isn't just that groups can make a donation to cover this training. Some groups have put their hand up and said, hey, can you train our whole employee base or agency? And the March training is the Owen Sound Police Services, and they have they're training as many people who are interested in attending, because again, another group who sometimes kind of crosses paths with individuals who maybe aren't doing so great is our police officers, and they do this on a day-to-day basis, so we want to make sure they have the skills needed.
Excellent. Now, I did pull up the ASIST, the Applied Suicide Intervention Skills Training document, and but so you have goals and objectives. So you obviously want to provide something to the people. Do you mind talking a bit about the goal of the program and what people will leave with?
So the first is more confidence, because we look at sometimes, we'll talk about sometimes if somebody falls down and hurts themselves, people just instantly show up, right? Like they're like, oh my gosh, are you okay? Right? Like, can I call an ambulance? Do you need an ice pack? Like there's going to be someone who offers to help. Even if it's just calling 911, I'm going to call 911 and see what needs to be done. But sometimes when it's suicide related, or we're just not sure, that just doesn't sound right. If we're not confident in our skills, that can lead us to sometimes back away and go, I don't know what to do, so I don't even want to approach, just in case I mess this up. We say that in our heads all the time because we're innately helpful people, but we're so scared sometimes in this situation, we don't want to make it worse. And what the whole objective of the training is to give you confidence to lean in when you're worried that suicide might be present. And we all have this built-in suicide little radar thing, and it's called our intuition, our gut. Just something just doesn't sound right or feel right, and we teach participants to follow that gut. If your gut is saying something doesn't feel right, then 99% of the time, your gut is catching a symptom of suicide. And again, we just want to give you confidence to know how to start that conversation.
I really liked your phrase, lean in. To me, it's leaning in, not backing away, and being able to getting involved. Now, I know for people who assist with physical injuries, there is a Good Samaritan law that protects them from any repercussion from trying to help. Does that apply for someone who tries to use this training for suicide prevention then?
So we word that a little different, and that's being gentle on yourself, because the underlying kind of message of ASIST is the way the statistics are and just the way the world is, we know we can't help everybody all of the time, but we can always help someone. And sometimes we put into practice and we do what we can do the best, and sometimes we still don't have a positive result. And so a big part of the training, Carol, is that it's there's on one side, it's the confidence moving ahead, but on the other, it's just making sure that we protect ourselves and keep ourselves safe. That even if I did my very best and it didn't end the way I had hoped, it's at least I did what I was trained to do, and at least I did my very best. And when we think about suicide, if someone isn't doing so great and death is on their mind and living is really hard, you honest to goodness, you can't mess it up because they're already feeling so many big things. Nothing you can say can make it worse, if that makes any sense at all. And so what we say is just approaching and saying, hey, are you okay? You can't mess that up. There's nothing you can do wrong there. So I love that you brought that up. That's a really good question.
So from your experience training, what have been, when you've watched people go through the training, what have you seen from the time they start to the end of the 2 days in the changes? And do those changes also help fine tune the radar to listening to the messaging?
I love that question because one of the things we say, okay, just so you know, you are probably very likely to put this into practice as soon as you walk out that door, because it's so present. Like 1 in 20 of us can have thoughts of suicide at any one time for whatever reason. And we say, like, when you've been here and you've been learning and talking, that little radar gets honed, and it was probably working before. And that's what brought you to the training, because you're probably thinking, oh, I wonder if like there was something I could have done in that scenario, or is there something I could have done in this scenario? And that's what, like, 90% of the time, that's what brings someone to the training. They're like, I worried that maybe I could have said something and didn't, or and so that very much is at play. And when people come, it's about building that confidence to lean in. And when you have a model and a pathway that works and can help, yeah.
Participants, I would assume, throughout the program, start to learn more about the resources available to people.
Mm-hmm.
Provide that information, I'm assuming. It's not that they have to be the experts.
Yes.
Doorkeepers, or how do they help get people to help?
Mm-hmm. And that's if we hear anything in the training, it's, oh my gosh, I didn't realize there were so many helps out there, and that's that's exactly it. And so during the scenarios, we do a lot of what ifs. And those what ifs are, well, that's what this help is for, and that's what this help is for, and this is when I would call, 911, or this is when I would take an individual to the hospital, or, this is the help I would connect them to. But ultimately, what ASIST is all about is we want that person that we are having a conversation with, that we are helping, we want them to be comfortable with the helps that we're suggesting. So it isn't necessarily about, oh, we should do this, we should do this. It's about making sure that that person is engaged in that conversation. And ultimately, when we have conversations with people and we ask them how they're doing, and we let them be really honest with us about how they're feeling and what's going on in their life. When I always say, when you let a person tell their story and you let them start at the beginning, get to the middle, and get all the way through to the end without jumping in the way of it, odds are by the time they get to this present moment talking to you, they might say something like, what do you think I should do? And that's when we then talk about helps. Well, there's lots of options, and the goal is to find one that they feel comfortable going to, because then they're more likely to go that next step.
Sometimes people will say, I'm afraid I'm going to say the wrong thing.
Mm-hmm.
Or
Mm-hmm.
really not my business, best I stay out of it,
Mm-hmm.
if it's or whatever. What would your advice be around, about those things? Are there any
Mm-hmm.
wrong words to use? Or is the listening the key and being present
Mm-hmm.
and able to link them to resources?
So the first, yeah, you got it. The first thing is, if I'm using the wrong words, it's because I'm talking and not listening. So like, it honestly is, that's exactly it, right? But again, there's really no wrong words when you're sitting down and having a conversation with somebody, because the opposite is the worst. Can you imagine if someone has been experiencing these thoughts and they've been navigating these thoughts and no one asks them if they're okay? And oh, there's a Jill. And so when we look at that, we just want to make sure that people recognize that just asking each other if they're okay, we all need to talk about these things when they're in our life, and we want to be able to say them out loud, and you're giving them the opportunity to do that. I kind of look at it like sometimes way back in the day, condoms, right? We would worry about giving out condoms because we worry that, oh my gosh, people are just going to take that condom and run out the door and use it right away because like we just gave it to them. It's like, no, a condom is a preventative thing. And that's what we want people to recognize about suicide. Because again, if we know that 1 in 20 of us are dealing with these thoughts and these experiences at any one time, just being able to say it out loud can make such a difference.
Yeah. So individuals who've gone through the course and then have actually practiced the listening skills and had an occasion where they've had that experience, do they have an opportunity to debrief? Like, what do they do with that? Because I would think that would make quite an impact on the individual.
Yeah.
What's the right word, but
yeah. Because what's more exhausting, going for a marathon, which I do not do, or listening to someone's like, oh my gosh, the crap that's going on right now and the place they are in and what they're experiencing, like that can be, you just think, wow, that's a lot that you're going through. And that can be just as draining as going on a marathon. So yes, self-care is part of the training. They have to tell us what they do for self-care, and that's a part of the day. But also on a little bit on the flip side, my favorite thing is I tell people is, again, like just a warning, you're going to put this into place because we all know 20 people, and odds are we're going to find ourselves in a moment where we're like, that doesn't sound like them, and there might be suicide present, so I'm going to have a conversation. And I love when I tell people, I say, please, like, circle back to us and let us know. And it's amazing, Carol, the number of emails I have received within 24 hours. And somebody says, I went home and I was talking to my kid about this training that I took, and they said, Mom, that's exactly my friend, or that's exactly, me, or that's it, right? And because when we start talking about it as a community, it's amazing the doors that it opens, that people realize, oh my gosh, this is a safe person to share this with, and then amazing things happen.
So the act of listening actually opens doors for others to get help. We have about 30 seconds in the program. Any last minute words other than sign up for the workshops?
Sign up for the workshops. You go to graybruce.cmha.ca. It's going to take you to a link where you tell me which days you want to come, what your food requirements are, because I want to make sure everybody eats. And then just a phone number we can reach you at in case, we've had fog days, snow days, COVID days. So you fill in that little form, and it's that easy.
So we certainly encourage people to take the course, and I understand you'll take the course out to organizations as well. So you do it in a location, but you're also mobile.
Connect with us by visiting our website or email us at comments@rogerstv.com. Public transit, garbage pickup, parks and recreation programs, snow removal on your street. How can you stay informed about these and other important local services? Tune to City Council coverage on Rogers TV. See your community leaders at work on Rogers TV City Council coverage.
Mondays on City TV.
I feel strongly about so many of these women. I have nearly get you out of my mind. I have zero doubts that one of these women is going to make me the happiest man in the world. And it gets me excited to think about it.
Who the hell